everyone. Today is a wonderful day. I'm going to interview my beloved teacher, Professor Dr. A.V. Srinivasan, who is eminent neurologist, a great academician, able administrator, who has a vision for social cause, and a person with human touch. And it's my privilege to interview my teacher. And I am going to divide the interview into some subheadings like about his parents, his childhood, his school education, college education, professional education and experience, and his administration contribution, academic contribution. So let us start the interview. Good morning, Professor Dr. A.V. Srinivasan. It's very nice to interview you today. Could you tell us about your parents and your childhood?
First, let me say thanks to Indian Academy of Neurology for giving this opportunity to speak with all my wonderful people in India and abroad. I'm particularly thankful to Dr. Payani, who has also risen to great heights. And it's indeed a very happy moment for me, who bears the name of Dr. Payani is a very important name in our India. Dr. Payani, my family is from a place called Avatwadi, a village in Dharmapuri district. And my father had two elder brothers and one younger brother. And they used to be, all the four gave a very good character and conduct for us. I strongly believe truth is mother, faith is father. My mother was absolute truth to the extent, and my father to the faithful person who made me what I am today. And I think my childhood, I would say that it is in Triplicane. We were in a small house, and my father gave everything to us, abundant love and faith. My mother was absolutely truthful, and they are the two eyes for us to come to life. Because I strongly believe truth without faith is blind and faith without truth is deaf. I think those things are taught by my father and mother. That made me to go through my 6 years of life with absolute love and affection. And immediately after the 5th year, I joined in a school called Mani's Preparatory School. It is correctly called preparatory school because they prepare you for your conduct, your character, your attitude, your aptitude. And they taught us excellence in our thought, word, and action to come to in life in the first year, first form in Calet High School, which is a CSI school. They really brought the best of each and every student of us. They really taught us how to behave, how to have the character. They mixed knowledge and made all of us a very great school. And the happiest moment in my Calais school, I played for my school in cricket. I used to keep opening batsmen and I used to keep wickets. I'm reminded of Dhoni now. At that time, no Dhoni was there. But I really enjoyed my school life up to the 11th standard in a wonderful school. And they taught me and they gave me prizes also. And with that, my school came to an end, giving me the character and as well as I call it as a behavior.
So when did you thought you are going to become a doctor? When is your vision of becoming a doctor? You start getting at this.
Yeah, in my father and mother were next house. And the greatest physiotherapist who started the physiotherapy department in India, his name is L. Vitral Rao. He was living next to our door. And those two people literally inspired me that one day I should become the doctor. And I wanted to be only in Madras Medical College studying and reading well. And they are the inspiration to me because those people, the friend people, the father and mother, daughter, both the daughters were doctors. They were one, and they are the people. One was a gynecologist, the other was a pediatrician. And the touch of her will take the fever and as well as the fever and all our diseases off. That is the starting point or the thread that was put in my mind that I should become a doctor like her. We are ever grateful to Dr. Ananta Krishna and Ananta Lakshmi and their family and the personal director Ananta Raman and their family for giving us the initial inertia that completely broke us and got into this medical field later.
Could you tell us about your medical education and your experience in the medical college as an undergraduate as well as a postgraduate?
So to get into medicine, I think I should remember DG Vaishnav College. And this Vaishnav College, I did my pre-university. And the principal was so kind that he used to come to everybody who was standing under the tree. Read well, write well, don't come off from the exam. You will be successful. And I still remember in PUC, we stood second in this Tamil Nadu ranking next to St. Joseph College. Maximum number of people entered into medicine. And this particular college I wore in existence, and I was very happy that I was given the World Health Day. I opened up and recently gave a talk to people, the value of education and excellence. I think that college, Vaishnav College, really gave me the heart and then the soul of them to make me what I am, and I got into first year medicine in Madras Medical College itself. And Madras Medical College in those days, it's called the queen of all the Southeast Asian medical sciences by the British people, and it started. And I joined first year and second year. Still, I remember all my basic teachers and my classmates, and all of us, I think, sailed through without any difficulty in the first year to final year. I think the medicine, I still remember the two great people. One is Professor Ratnayali Subramaniam. I really pray to God that his knowledge should come to me, because in 1960, I was admitted in the hospital in MMC itself as a 10-year-old boy with a possible septicemia, what I know now that. And Ratnayali Subramaniam sir came, he asked me to open my mouth and said, "Who operated him on these tonsils?" And then that was the beginning story of the Professor Harris. He came very near to me. Sunny, he used to call it Ennappa. And he said, "You will become all right, don't worry." There was a mild surgery, and then that surgery was done. I became all right. He is my first heartthrob. And the second person in my MD taught me the basic principles of medicine, Professor K.V. Thiruvengadam. In our days, we used to have all the chiefs. They were always teaching us the perfect knowledge and then the character. Once again, to name a lot, Professor Sam G.P. Moses, he was a great soul for all of us. Professor S. Balakrishnan's unit, I did the MD General Medicine second year. And then, of course, you had Professor A.M. Selvaraj, and all of them, they gave us all a very good one. And I finished my MBBS in 1973 exam, finished House and C in 1974, and joined as a senior house officer, once again getting trained in cardiac. So I worked in all that specialty department, each 3 months, 3 months in cardiology, 3 months in neurology, 3 months in gastroenterology under Professor Madana Gopalan, and the cardiology, Professor C. Lakshmi Kantan. And of course, we also came and did the first interest in neurology came when I was a senior house officer. There is a PL 480 scheme going. And at that time, 1975, the Institute of Neurology, the Silver Jubilee celebration was done. Prior to that, we used to write the PL 480 cases. That's the beginning story of the connection with the Institute of Neurology. And the most important thing that I noticed in MMC was that all the teachers were absolutely dedicated. They loved all, they really served all with their knowledge, and they made us to work heavily. And know that we never had any stipend for our course till we completed by DM Neurology. No stipend for the postgraduate, and there were no assistants also. So DM Neurology in 1980-82, thanks to Professor K. Jagannathan, who called me and said, "You have been selected." And 5 of us, I still remember the lovely time that we all had, having a cup of coffee after the rounds in the morning. And it was a lovely period, and then finished DM Neurology. But for a short time after my MD General Medicine, I worked with Krishnamurthy Srinivasan and in voluntary health service. And above all, they all taught me the basic fundamental, how to get the knowledge, education, and how to get the excellence.
So could you tell us about your experience of your DM neurology postgraduate training, then as an assistant professor of neurology, then as a head of the department of neurology, in Institute of Neurology,
Now,
Madras Institute of Neurology.
I think I always call it, we had the 6 gems of, I can call it 6 diamonds forever in our neurology. And I still remember when Professor K. Jagannathan asked us to go to the 4th floor. And then we met Professor Vishwakumar for the first time. And he taught us the basic of neurology and inspired us to continue on Professor K. Jagannathan. And I always call it Professor Zahir Ahmed Said. He really made us to speak properly. He made us to write properly. And he was excellent. His excellence in expression is unimaginable. It will be explicitly expressed in every statement of him. He was a real, what we can call it as a professor who taught us how to really become a very sensible person. Professor K. Srinivasan, absolute perfection. Excellent, trained in UK and then came to India. Man of perfection, and then never used to say anything other than timing. He believed in the time, and he will criticize to the left and right if you're not coming to the wards on time. He really kept the OP and then the teaching line. He used to carry all the instruments to the OP. We are ever grateful to Professor Krishnamurthy Srinivasan, particularly myself, because he gave the light to me. And when I was refused by the British High Commission that I'm not selected for the fellowship, when I went and then told him, sir, I'm not selected. He said, who said you are not selected? You are already selected by Professor Marsden. Get me one letter ahead. And then he wrote a letter directly to the secretary. See, that was the love and affection for the postgraduate that they had. And he said, you will get it, don't worry. Then I really got a reconfirmation letter 10 days later. I can never forget my life, the man who gave me the real lift in England. Of course, Professor Kumaresan, sir, is the person who really taught us a beautiful pediatric neurology and also an assistant professor to K. Jagannathan at that time, then later became the reader. I mean, he is a source of inspiration to all of us. And with this, I think I am very much grateful, indebted to him forever, because he is my mentor, teacher, and made me what I am today, Professor C.U. Murugendran. He really taught us how to really good, because he was, I would say that he was the king of all the people who taught him, so that he really taught us very well. He concentrated on the clinical neurology, and he really made me what I am today. I have my pranams to him today, because he is not only the light, he is also the knowledge to me. And he gave everything in my life as a professor. He did it very well. And of course, we cannot forget the surgical people also, who came very, very beautifully in every aspect. Professor Kalyan Raman, Professor Narendran, and all my very, very close person. Let's say easily the golden period of Professor Mohan Sampath Kumar, with whom I was the professor at that time. But I think my classmate is the first person in this country, Professor K. Ganapati and Professor Ramurthy, Ravi Ramurthy. Both of them joined the 5-year course. And now I think Ganapati has reached the highest ebb in the field of telemedicine. And I requested him to give a speech on, published a book also on telemedicine way back in 2007 and 8. He really gave one lecture and did the Institute of Neurology oration, talked on the telemedicine as early as 2008 itself. That's a fantastic, his attitude and aptitude gave him the correct position now. Now, my training part of it, if you say, I think we are very, very grateful to all the chiefs, 6 chiefs, I call them. They really made us what we are today. I think, I still believe that they are the 6 golden gems in our life. They will do in life everything to everybody. It cannot be forgotten. The clinical neurology, he used to give us the full, complete freedom to express ourselves. To that extent, he used to say, my classmate V. Natarajan and Vijay Shanmulam, he used to say, I used to have 3 chiefs in my unit. And that was a point that he was using, sir. I think our batch, the DM batch, was excellent. And to tell you frankly, I've just missed one point which I have to mention it here. In my medicine days, 83, 6 of us became the heads of the institution in MMC in 6 different departments, starting with STD department, Dorraj, and then Director of Medicine, Dr. Raghavan, and our first lady in the surgical, Dr. Of course, Sri Kumari Damodaran, Director of Bernard Institute of Neurology, Dr. Ayyappan, and Dr. Swaminathan, and Ayyappan in the cardiology. And all of us did very well. And 6th person was myself retiring in neurology. I think this is the only medical that is batch which had 6 professors in 6 different departments in MMC, my batch. I'm very proud of that particular MMC batch 1974 when we passed out. Now, coming back to the neurology department, I think what we are today, firmly today, and from 1980 to 82 and finished the neurology in 84, I think it is nothing but accelerating, and as well as what I call it, they really increase our intuition, they increase our intelligence, they increase our industry. They made us to become an important individual in the years to come. These are the 4 eyes, I always call it. I think this is the, and perhaps the professors, they had the eye and to teach us all. And it was a fantastic experience that we had in the neurology. And Professor, particularly I must say, when Professor Vel Murugan and I wrote the application for a Commonwealth Fellowship, as he was signing, he said, "You have got it." That is the principle of practice of medicine with absolute love behind it. And I think that paved the way for success of my life. And the people who made me what I am today is also the DM students who have seen me over a period of time. The real fundamental, I call it as the basement is done only by the Institute of Neurology, so that I could build my own building at my own leisure time.
Very nice, sir. Sir, I very well remember you are the person who's taken up movement disorder in the very early part. It has grown up as a very big specialty now. I remember he went to UK, worked under Professor Marston, and done a very important work on neuroleptic malignant syndrome. So could you tell us about your research work in movement disorder, especially under Professor Marston and your UK experience?
Now, 1993, exactly in September, I was selected to undergo training in Professor Movement Disorders, Professor Movement Disorders in charge at that time there. When I went in, he said, "You are posted to the Medical Research Council. You are not posted under me." Then I told him, "Sir, this is my really desire to work with you in clinical side. I'm not interested in going to the research side first, but I want to know the clinical points. And I want to work under the clinical points under you." And he took me to his unit straight and then made me. And I felt it was absolute delight to watch, because we were given a separate room. We were given a computer. We can contact any professor in the world. That is something which is a first of it. I learned my typing there because nobody will help you to type. And they gave a computer station, everything in a separate room for all the registrar. And we were taken as a registrar of Registered Medical Council, British Medical Council. And that forced us to go into different portions during our career. And in fact, Professor Marsden said, "And you do it." And he came and discussed, "What is your thought process?" I said, "Sir, we have published a paper in 1990 that the neuroleptic malignant syndrome, the world looked at it as a whole. We were the first person from the Institute of Neurology looked at it as probable affective disorder versus the schizophrenia." Professor Zahir got so much interested. And in this way, I must say, particularly Dr. T.S. Kumar, who really wrote the case sheets for that, and we assessed that. We have transferred all the patients with a possible NMS into Professor Zahir's unit, and we were able to really see the work. And that only made me to present to Professor Marsden that there is a distinct, especially evolution, resolution, and also the mortality rate is definitely more in schizophrenia, and it appears earlier, and it takes a longer time, whereas in affective disorder, it takes a shorter time and then takes a longer time to appear. And by that time, the Rockefeller Library, I had the full documents on all the animals all over the world and collected it. And I showed it to Professor Marsden, said, this is distinctly, nobody has done it so far. And the moment he saw that, he offered me even why don't you do a research here? But at that time, I was already 38 and 39. I told him, sir, I will do the research in India, but please do it. This is a new point. And he wrote it, and it's fine when I wrote the paper. Of course, the first 3 uncommon movement disorders, I presented it from the Queen's Square in London. And he also wrote a personal letter, and my membership in the American Academy was proposed by Professor Marsden and seconded by Professor Quinn. And they made me as a monitor for a session, and I was eligible for 3 sessions. I think in each and every aspect, he took care of us. Thanks to Professor Srinivasan, who introduced me to Professor C.D. Marsden of England in India when he came for the Srinivasan lectureship. That paved the real ground for me to go confidently. I think this neuroleptic malignant syndrome, I came back and did the PhD under Professor C. Velmurugendran, and both of us gave the world literature AVS-CV criteria. This is the first work in the whole world, because I wrote almost all the people in the world, whether they have looked at it from a schizophrenic and affective angle. Nobody has looked at it, and they all gave it in writing that they have not looked at it. And that gave me an impetus to do the PhD in neuroleptic malignant syndrome here. That is one side of it. The other side of it, the Queen Square, you name it, the floor, each and every floor, you are able to see the people who wrote the textbooks in neurology. Underground, of course, we had the radiology department, which did the maximum. And then we had the P.K. Thomas for the peripheral neuropathy, the great soul. And the genetic person was also there. And the Anita Harding was there for the genetics, and then she was holding the unit. Professor MacDonald, he was also there. And above all, the neuropsychiatry people also. Every floor, we were all given in the 6th floor, but each and every floor belonged to one department. That is the beauty of, after seeing that, Professor Ramurthy almost constructed our neurology department has head injury ward down below, 1st floor investigation, 2nd floor theater and ICU, 3rd floor is professor's room, 4th floor male ward, 5th floor female ward, 6th floor pediatric ward. See, this is really after the Queen Square. But I have not seen the Montreal Institute. Professor Zagin might be able to say that. It is also looking like a mild one as a Montreal Institute of Neurology. So I would say the real thrust for movement disorders was done in 1994. When I came back in India, nobody was interested in doing the surgery for the movement disorders, including deep brain stimulation. It went off with that, and then we also brought out a book on movement disorders. Slowly but surely, there are 2 entities, I always call it, the movement disorders and behavioral neurology. They are the 2 really fertile soil for us. I think somewhere along the line, I missed the bus of movement disorders getting fully into it. And I took into the behavioral neurology under Professor V.S. Ramachandra.
So you are a guide for 6 PhD in neuroscience. That's a phenomenal work. And you're also an adjunct professor for Indian Institute of Technology, IIT Madras, and done a lot of primary research work there. We discussed, you informed me about that before. I want to know about your important basic science research. You have been part of the basic science research institute, Indian Institute of Technology, and the Institute of Neurology, Madras Institute of Neurology. You are an invited guest lecturer for many international bodies all over the world, and you've done a lot of guest lectures. You have been honored everywhere. And you are a fellow of Royal College of London and fellow of American Academy of Neurology. Kindly tell us about your important basic science work, as well as that important guest lectures you have delivered all over the world.
No, in fact, the most important of all the important guest lectures, I felt in Cleveland, I gave the new dopaminergic hypothesis. That's a basic science work, the Freeman's. And I think Mark Hallett was the chief guest for that particular hypothesis. I am the first person to say that in the dopaminergic hypothesis, Mark Hallett chairing the sessions. And he asked me if only I had done the biochemical test, it could have been reached. But anyway, my particular portion was that when you have a D1 receptors, I fixed D1 receptors is more in cortex than D2. In basal ganglia, D2 receptors are more than D1. The clinical significance of that is when you give a drug, and when that drug blocks both the cortex and as well as the basal ganglia, you get the syndrome, neuroleptic malignant syndrome, which comes very fast and lasts longer and causes mortality. Now, people have done CT PET analysis, neuroleptics naive patients in both US and Europe and Germany. They found that the cortical system was preserved, whereas basal ganglia is affected when you use the affective disorders. That made me to write this hypothesis, a new dopaminergic hypothesis. I went and then wrote that people have to quantify the number of dopaminergic neurons in cortex and basal ganglia. The first part of my statement is true now, proved by animal studies. That is, the D1 receptors are appearing to be more than D2 in cerebral cortex. When it comes to basal ganglia, still that has to be proved, because I said the D2 receptors are more than the D1 receptors. And that lecture I gave it in the Cleveland, Ohio. It's a Monday evening lecture where it will telecast live throughout the US. That is the first thing that I did. And the second thing, of course, once again, and same, the university, 3 universities asked me, thanks to Professor Tyagarajan Subramaniam, and who helped me, asked me to talk on this and take a class for students in that. And I moved with all the foreign professors. I had the opportunity of visiting at least 10 institutions. And the second good work, if at all I do, was the intramanual referral of sensations, for which I got the award in 2001 in Philadelphia, because the world has done only intramanual referral sensation. If you touch one hand, you don't feel the other side, because of the ipsilaterally, it only 15% goes, contralaterally 85% goes to the sensation. But when you go, a patient who has got a sensory deficit and the hemiparesis, that patient do not receive the 15% here. And so when you go and touch the normal hand, the 85% of the sensations on the opposite hemisphere is not reaching. But this 50% of the ipsilateral is very, very want of any touch or sensation. The moment it reaches, you are able to see you are being touched on the opposite side. This is the world first intramanual referral of sensation done by Krishna Satyan. But I extended it by saying that if you use the proprioceptive sensation like pressure, vibration, movement, position, or touch, by applying it on the normal side, you can improve the spasticity. You can improve. We have quantified it. We have did it with the experiment. My sincere thanks to Professor V.S. Ramachandran, and who helped me in this particular paper. And we joined together, produced 5 papers, research papers in basic sciences. I think that has only paved the way for all of us. I think next is we wanted to stimulate the vestibular nucleus and then giving relief for delusions in schizophrenia, pain relief in the especially CRPS syndrome, and third is in the patient with the stroke. We injected and they were able to do excellent work with regard to the improvement in the stroke patients with
is being recorded.
Sorry? What happened is when you inject the cold caloric water onto one side, the opposite side stimulates, and the patient temporarily who has got not able to identify one side, hemianopia and hemianasagnosia, also improved. So we were the first people to bring out this sort of basic investigations using the vestibular stimulation. Why we fix vestibular stimulation is it is the only clinic now which is going through the different parts of the brain. So the first people, world has seen already the blind side, and we produced for the first time the unconscious sensory perception in the whole world literature. So these are all certain basic sciences research that we did and then published it. And we have done this. We now know that even cancer breast patient, the ear lobule lies next to the breast in the brain. So when you have a cancer breast operated and phantom limb comes, you go and press the ear pin, they will get an excellent relief from the pain in the non-existing breast. Same thing with regard to cancer penis patients, where the toe is adjacent to the penis in the brain. So when you get completely removed your penis, you get painful sensations in the phantom pain in the penis. So you go and then press the toe, you will get a relief. These are all some of the case studies that we have shown it in the world literature, which really gave me an opportunity to see some people. And there, Delaware, where I gave a lecture on this, and they showed me, of course, how the epilepsy is produced. This, it was an excellent, fruitful exchange of our knowledge with the greatest people living there, giving me the knowledge in them, because I really learned a lot from the foreign institutions. And some of the work which I did, I think this is there. When I finished my DM neurology, I started the movement disorder clinic and presented at least 6 papers: movement disorders in headache, movement disorders in stroke, movement disorders in mitochondrial cytopathies, movement disorders in myopathies. Everything we presented in different parts of the meeting. And this helped me to really round off my knowledge, and lot of people gave me encouragement, and we were able to do that. Particularly IIT, where we did a design by which we can do something for the Parkinson disease. So these are all some of my wonderful thoughts over a period of time from the Institute of Neurology. I think we did that. Above all, I think it was a continuation in an institution for 50 years. That only gives this opportunity. I'm one of the very few, probably I didn't know that, but I have stayed now for 52 years. And my first PhD thesis was in the neuroleptic malignant syndrome. This day, I still remember M.R. Shivakumar, one of my best 10 postgraduate students in DM neurology, an excellent person with phenomenal memory, and a Johnstonian in MMC. He did the first paper, which was noted in American Academy of Neurology, the first 100 papers, HLAB 1502. Actually, this is in Caucasian group. It is not, even if it is seen, it doesn't produce that syndromes. Whereas in Indian population, which is about 9%, we found that there was a distinct reaction to the drugs that we give, anti-epileptic drugs. And except probably levetiracetam, most of the other drugs we proved it does produce skin reaction, probably toxic epidermonecrolysis also produces that. And he did that PhD. And the first person in epilepsy to get the PhD, Professor R.M. Bhupati. I mean, this is a medically intractable epilepsy. It is a fascinating experience to see that he really spent a lot. I don't want to say the number, but that only gave a real basis now for anybody to do the PhD in the intractable epilepsy. I think they should look into the thesis of Professor R.M. Bhupati. Same way, Professor Lakshmi Narasimhan, the present director, I think he gave a real, what I call it as a beauty. And it's a joy forever to just see how the work he did, and then got his PhD in the radiology, and the dementia component part of it is a different, beautifully one. And I tell you, such a difficult topic, Dr. S. Gopinathan, he did that in the headache, and he got the PhD in headache. You must really see how really hard work he did in giving this particular paper. And now the other paper which we are now doing, she will also get it. The Nayak, Mrs. Nayak, I think she has done the work on the physiotherapy and then the utility in the stroke patients. Each and everybody, and Dr. A.C. Somasundaram, work on demyelination. In our days, when we say demyelination, people will fail in a multiple sclerosis. But now we know MS is very common. And he's the first person to touch on the demyelinating and then the electrophysiology in the multiple sclerosis. I think it's excellence is explicitly expressed in the demyelination. I'm very fond of saying this particular combination. It really goes to A.C. Somasundaram, who had done a lovely work. I think these are all the people who did the PhD work under me and richly deserved it. And I'm very happy that I've been an instrumental one, because hard work is done by them. Of course, the idea of a teacher is to leave the thought unguided in the years to come, and that has been done to these people. I think they have achieved the greatest heights in their own institutions.
So recently, Madras Institute of Neurology has celebrated your 50 years of experience in clinical medicine at the Tamil Nadu Dr. M.G.R. Medical University. I have participated in this. So it was a wonderful thing. And to know that you spent 50 years in clinical medicine at the same institute for quite a long time. And could you tell us about your experience as a president of Indian Academy of Neurology?
I think I'm one of the luckiest guy to name that, because Silver Jubilee celebration, the president in his own place. Thanks to all the people, in particular to you, Meenakshi Sundaram, and the Pondicherry professor of neurology. Everybody came and then told me that I should stand for presidentship. I went and asked as usual, because whenever I'm in a indecision, I'll immediately go to Professor CV and asked him, can we stand, sir? He said, you're standing and you're winning. Finished. See, that is the positive attitude and aptitude of Professor CV. He said, you win it, and he signed the papers and then sent it. And all the people, I'm grateful to the neurologist of the Tamil Nadu who have voted for me. I think that is the greatness of all the people of ours, especially Tamil Nadu people. They really had the love and affection for me. Paranjodi, of course, from Pondicherry, he said, see, we have all voted for you. And because of that, I won't say you have won. You have got the people from Bombay, Delhi, Calcutta, everybody voted for you. But if you're not voted, you would have been defeated. But anyway, that's what Paranjodi said. I think they are the people who really stood behind me. And they made me what I am in middle. And then it was beautifully organized by Professor and Chairman, my mentor, great teacher, Professor Murugendran sir, and ably assisted by Human. I think it is easily one of the finest Indian Academy of Neurology meetings, annual meetings. Thanks to those two people' effort, it really borne fruits, and then the best place in the state. But in order to satisfy myself, with great difficulty, I brought out a book on 450 pages. I called it as a Diamonds, the Jewels in the Indian Academy of Neurology, in the Crown of Indian Academy of Neurology. That book we published. And we were really giving all the president's people. And I am very grateful, because when I assumed the office of the president, thanks to all the professors of all over the country. And it is something which, it is a memory which will be etched permanently in my head till my last breath. I think that's the best time that I had in the as a president of Indian Academy of Neurology, culminating in the 50th, when I give the summer teaching program for students as a past president of IAN, and attended by our president, secretary, and treasurer, the Dean, DMA. Everybody came and then stood behind me and then gave me this 50th award. But most gratifying one was, I am very grateful for all my teachers who came on that day, and they were honored, because I reached this position only because of my teachers, all of them. I think that is easily the point which I want to have it in the back of my head. My teachers helped me what I am today, and my students taught me what I am today. I think I have a greatness in both of them. So the real work in the Institute of Neurology still, I think, they give you the time, place, and in life, you have to have 3M, but you cannot have 3M. One is MMM, is megalomaniac man's attitude, that I know everything is absolutely ridiculous. Other is manpower, money power, and this as well as motivation. Institute gives you the motivation. The money power is given by the people around you. I think manpower is absolutely needed in any institution to reach the highest honor. That I would submit up in the education side. Yes.
So it's very important to note from your interview how a mental discipline, methodical and hard work, and a multidisciplinary approach can take a person to a height. It's very important to learn that it is very important to be overall, both clinical medicine, clinical practice, academic practice, and taking everyone together on our path, and mentoring people. You have mentored many people. There are many postgraduates you have produced, many PhDs you have produced. It's very important to balance the life. So the lesson is to learn that balancing is more important, not overdoing one aspect of profession. So could you tell us in conclusion, what is your suggestion or advice to the upcoming neurologists to be successful in life?
I'm very fond of saying two things. To quote Professor, as my God, Sai, he only said, medicine plus love is Medicare. Medicine without love is medicine. I think I would rather go by the teaching of Sai, and I think that is really fulfilling you in your life. As an individual, when you are going to be in life, I think one should follow this. I place the Sai as the first. And the second thing is because Sai is going to give the real life character of an individual. You should be able to abide in your judgment. You should have positive attitude and positive aptitude. Attitude is positive, that is mental. Aptitude is positive and as well as mental and physical. The brevity should be your expression and see clarity in your thinking. And most important thing is you must have the dignity and as well as the discipline. Once you have that, your excellence will be explicitly expressed, and you will have a form of life in which you really be a successful with the grace of Lord. And you should have the hope in your life that eventuality can be delayed but cannot be denied. And hence, achievements are in your hands, whereas recognition is in somebody's hands. If a person does not get recognized immediately, don't leave hope. Recognition will come one day when you are going to achieve more and more. I think the moral of the story in any life is you should not aspire for recognition, but you will always get the recognition over a period of time because recognition can never be delayed. The basic factor is the for any recognition work and everything is I always call it inspiration. Inspiration is the most important point. Inspiration, I give always a statement. Inspiration, intuition, and intellect is already we possess. It will give you 100%. You're going to be intellectually important individual in the days to come, and that intelligence is going to be a joy for you forever. And with that joy, you will have absolute jubilation in your mind. Jubilation comes because you have all the knowledge. Knowledge and wisdom is really given, and this knowledge will kindle your intelligence so that you get the wisdom later. When that occurs, L stands for lingers permanently in your life because man lives the moment the second pass. I am very fond of saying this. Present is a word. Is present is PRE becomes the past, ENT becomes the future. S is a moment which follows the past and looks into the future. S is a moment and it is a present and it is a pleasant. I think once you do that, that will give you a motivation in your life, and it will be nurtured immediately by very good teachers, very good students, because I strongly believe when you are with a student, they nurture your intelligence. When you are with your teacher, they give you the intelligence. That is a subtle distinction. Because an ideal student is one who makes the teacher to go home and read. So that will make him to nurture this. And of course, everybody is omnipotent at the birth. And that definitely they operate in a particular field and then come up in life. And that is decided by the nature. And what you need for achievement of success is patience. Patience, perseverance, and lack of persecution, and position in place, and as well as predominantly positive action will give you success in your life. And the quintessence of all your action and everything is lying only with your hand. Nobody is against you. Nobody is for you. Please take this as a message, because in life, you be positive and you reflect positivity. And nobody is dead against you. Nobody can be dead against. He was against on that particular point, on that particular day with you. If you start taking that, I think you'll be more successful. The reality of life is always raised in the recognition and in the smile of the people whom you're going to see later when you're going to be in the old age. And it gives you the tranquility of mind. And then you should be able to train yourself and your offsprings and the teachers very well. And that will give you a wonderful idea of understanding the people with love and care. Finally, if of course you have this Vini Vidi Vici approach, that is, you come, you see and conquer the department, the institution, the professors, the assistant professors, the students. In turn, the students also really get, they come and see you, and then they get really benefit out of you, because the world is watching you for your, what I can call it as, you must be very careful and not slip. Reaching their position is different, and maintaining there is the most difficult one. I think you should do that. And Zeni of Sai and Zenial in me, years of Sai grace, and then earned for me is going to be Zen of Sai and Zeal in me. I think the Sai, when you say that, it is not religious, it is not political, but it is 100% truth that if you work with, think there is only one energy, and we are all matter, and that energy and the matter, when it combines, it becomes a human being. And the strong philosophy of life is the human mind is definitely, Tamila சொல்லப்போனா கடவுளை தேடினேன் தன்னிலை உணர்ந்தேன் தன்னிலை உணர்ந்தவுடன் கடவுளானேன் நன்றி. Thanks. Now coming to Dr. Paini. I have just kept it and I reserved it last. Thanks, Paini, for giving this wonderful opportunity to just speak to me. You are one of my best 10 students, which I consider it as, and you deserve everything in life. And a student can be praised in his presence. Son alone cannot be praised in his presence or absence. That's our ancient thinking. A student can be definitely praised so that he is becoming the number one. And the same thing, hopefully, I'll be living to see with every success of his step. I wish you luck. Next, I really think President deserves this credit. He has touched the hearts of everybody. Dr. Nirmal Surya is like I always call it 9 to 13 cycles per second, the Suryan waves. He has really spread the light on every people on this. It is not a praise, but it is actually coming into portion, the facts of what he has done. I think through this podium, he has really raised all important points of all the people. Kudos to him. He is a rehabilitative person. He's a great man who has done the work. And all the people in this country, I always feel that the neurology is not dead. Neurology is always living science. And there are articles which came as neurology is dead, but long live the clinical neurology. Because the clinical neurology is the heart of medicine. And same thing, brain is used for that. Thank you.
Thank you for your wonderful interview, sir. Have a nice day. Thank you very much.
Good day.